Not everyone wears their heart on their sleeves, but not everyone is Cora Millar.
She's funny. She's curious. She's a very smart, vibrant 3-year-old.
On the outside, she's a typical toddler, but on the inside, things are a little different.
Early on, we found out with our prenatal screenings, and then we were referred to the pediatric cardiology clinics with Dr. Sammy, and that's when he did a confirmatory echo to show that Cora's heart was a little special.
Cora has a condition we call hypoplastic left heart syndrome. Simply means that the left heart structure is underdeveloped.
Meaning Cora's special little heart needs to work a lot harder to keep the blood and oxygen pumping through her body.
She has a little blue tint to her, and they like to tell us that she will be a little winded with activity or have to work a little harder. But looking at her, you wouldn't know that she has half a heart only working. It's been a learning process. Cora was our first child, and we were parents for the first time with her, so it's been a learning curve.
Her short life has been full of learning curves. 2 open heart surgeries and a third looming. In the meantime, Cora gets careful observation and routine echocardiograms from her pediatric cardiology team.
But we need to see how it evolves over time. Are things stable? Are things getting better? Are things getting worse? Echocardiography it's non-invasive, it's not painful. It just involves some ultrasound gel on the chest and looking at the heart from different angles, maybe half an hour or so. So it's relatively painless for most patients, although, again, some little toddlers, for example, might not be very happy with it.
Being in a dark room filled with strange noises can be jarring. That's why the Millars started A Cure for Cora, an organization to quite literally shine a light on CHD and help take some of the fear out of those appointments.
And try to help a child lay still for a while. We thought could be improvements, so we help by adding lights and providing books to hopefully distract and make the experience a little better for the children and for the families too.
What actually the Miller parents have done for our clinic and our patient is quite phenomenal, I would say.
It's amazing. I mean, it's such a selfless act to have a child with hypoplastic left heart syndrome or other severe congenital heart defects. It's huge. I mean, it's a huge stress, a lifelong commitment, and to not only handle that, but also want to give back and help out others, I think just shows just really amazing.
Cora is definitely unique, but her condition, unfortunately, is not. An estimated 1 in 4,000 babies are born with hypoplastic left heart syndrome and will need lifelong care and observation from pediatric specialists.
There's a lot of big, bad, and scary that comes with a diagnosis like that, and especially if you're Googling being a first-time parent and wondering what life can look like. But CHD and complex CHD can look like this, and we couldn't be more fortunate for the care team that's helped her come all this way.
She's already come such a long way in her 3 short years, and despite hers being physically half of what it should be, Cora continues to embrace every task wholeheartedly.
She loves life, and she's our hero.